Hi everyone. In today class, we will discuss the next indirect method of blood pressure measurement, that is ultrasound method. So ultrasound method, here we are going to use ultrasound frequency in order to measure the BP. Okay, and then we are in conjunction with we will be having the sensor, that is a detector, to sense this ultrasound frequency changes. Based on that, changes happened in blood vessels. So this is the one line of description of what is ultrasound all about. So let's see what is this particular technique in detail. So this is the one type of method where you are using transcutaneous Doppler sensor, which is placed over your arm. This is going to be sense the motion of blood vessels in various states of occlusion of blood, which is being going to sense these different states of occlusions. That is whenever the vessels opens and or close according to the each heartbeat. The condition is that here your systolic pressure should be less than, that means dp is this diastolic pressure, and p is this normal pressure, and sp is diastolic pressure. This is the condition you have to meet in throughout the experiment. Okay, so when during this setup, when everything is in fixed, the here how we will be measured in the sense the frequency difference between transmitter and receiver signal, that is going to be proportional to your velocity of wall motion under the blood. Okay, so here we are going to send one frequency through source of the ultrasound, and then we are going to get back that frequency, that we can say reflected frequency in other hand. Okay, so this difference of transmitter and receiver signal will gives you the value of what is the velocity of wall motion of blood. So this transmitted and receiver signal will varies at different states of your occlusion. So in early case you have some difference at the point of occlusion, that is there is no blood flow. Okay, there is a point where no blood flow, that it will show some difference. And also when it the point when it get released, okay, the occlusion is getting removed, that point it will give some values. So through this difference, through this different values across various states of occlusion will give the values of informations about what is the blood pressure measurement. Okay, so see this diagram. This diagram will gives you clear understanding of what ultrasound is all about. Here also we are placing the curve. In the curve we have mounted of pair of sensor. One is the source, another one is the detector. The ultrasound source will will keep on sending the signal. Okay, that is it will incident the ultrasound inside the blood vessels. The other sensor is going to get the other one is act as a detector. Here it is going to get the reflector ultrasound, which is being reflected from the blood vessels. Return ultrasound, which is being reflected from the blood vessels. Okay, so for example, if you are sending 8 megahertz incident ultrasound, due to the condition of your blood vessel state, the some wave will get scattered, and some waves will get reflected. Here the detector will capture the reflected waves, so that will be processed, and then we'll have next we'll have audio amplifier in order to hear the sound. Because whenever your blood vessel is opening and closing, opening and closing each and every time, you will have some changes in the incident frequency with respect to the reflector frequency. That frequency will be further amplified with the audio amplifier. Then you can hear the sound of opening and closing of the blood vessels. That is the second part. But here how they are measuring the BP, in the sense, again during the occlusion, when you are giving cough at a very high pressure, you will not going to hear any sound. That is the point called systolic. Again when you are relaxing, okay, if it is closing, you will can't hear any sound. When it relaxing, you will start to hear the sound due to the turbulent force. Due to the sound, now what will happen due to the vibration of that wall of the blood vessels, what will happen, now the incident frequency will get reflected in some other range. Okay, that will again will be processed by a detector, and it will give one value. That value we represent is nothing but diastolic pressure. This is the another way of measuring the BP. This is the same concept, but this is something a different way where you can measure what is a BP with the help of ultrasounds. Thank you.